Hi, this is Scott Pop for Mobility Minute. Today I'm going to talk about plantar fasciitis and why I think it's commonly treated incorrectly, and I want to show you how I treat it. It is actually a condition that troubles a lot of people, and it can be very, very lengthy in recovery if it's not treated right. And the common treatments actually can make it worse often because they're not treating the actual cause. So let me discuss how I feel plantar fasciitis arises, how it's treated commonly, and I want to show you how I think it should be properly treated in order to recover as fast as possible and have permanent change. So what I consider the connection to the plantar fascia, which is basically the connective tissue from the heel up into the metatarsals. It's this tight band here, but this is just part of the whole posterior chain that goes all the way to the gluteal muscle, which then connects into the lower back muscle, which then actually connects into the shoulder muscle. So this is a focal strain of this posterior chain that can actually happen at any place, and we just happen to call it plantar fasciitis, which is an inflammation of this fascia, but it's because it's injured, and almost always this whole chain needs to be treated, which is never the case. What's commonly done with plantar fasciitis is the patient is put in a boot, which just immobilizes the foot, and it actually creates a heel lift, which then really creates a lot of strain in the pelvis. So it oftentimes makes the posterior chain tighter, and it may temporarily relieve some stress to the foot, but it also many times makes the whole situation worse, and the patient has a very difficult time ever coming out of the boot, because once they do try to do it, the strain up in their lower back and the gluteal muscle is still there, and it actually comes right back, and oftentimes it never goes away. If you only treat just the foot, you can get some symptomatic relief, but you're not treating other components that are feeding into this area. So I want to show you what I think is very important to do to treat the whole system. If you don't do that, it is a very frustrating, reoccurring problem. Okay, so the first thing that we always do is look directly at the area where the pain is. And the pain can be anywhere between the heel and the forefoot. If it's on the posterior heel, we don't really call this plantar fasciitis, but it is still part of this whole same mechanism. And what's important is this mid joint right here called the subtalar joint. And we want to make sure that there's good spin right here. And so we take this and we mobilize the foot and we stretch the fascia, and we really work on the myofascial elements here. And most of the time there will be specific areas that are very, very painful. Sometimes we'll do trigger point therapy right at the attachment. And other times we will actually do dry needling with acupuncture needles, which I'm not going to do here, but most of the time it's very effective right around the heel, sometimes up here. But the dry needling can induce the healing response in the localized tissue. Now this is the first thing we do. The next thing I will do is roll out the fascia in the calf muscle so that we really stretch that tight calf, and I usually use a piece of PVC, and we'll go all the way up through the fascia in the hamstring. I will stretch into the lower back. Keep your knees nice and straight. I will stretch the lower back up and through this area. This is called the quadratus lumborum stretch. Then I will have the patient lay on your right side with your right shoulder behind you. There we go. I will stretch the outer band here and really get into the gluteal muscle. Really work this whole IT band. Stretch up into the QL muscle here. Make sure that everything expands nicely in both positions of the back position like this. Now bring this leg forward and this shoulder forward, and the front position here. And we want to loosen up all the muscles going all the way up to the shoulder. Get this hip system through the gait motion so that there's no restriction all the way through. Then I will have the patient sit up facing that direction for me. There we go. Push your legs out that way. There we go. And we want to lengthen the deep, sit up nice and straight, lengthen the deep lower back muscles and twist this way here. And we're going to lengthen really all of the posterior chain from the gluteal muscles all the way up into the shoulders and even up into the neck, because this whole system works on the posterior chain. Then the final thing I want to do on the first treatment day is we want to use elasticon tape, and we tape up the arch and we come up over the ankle, and we want to create a very significant support system so that the tissues can heal. We've stretched them, we've mobilized them, and we've induced the healing response, we've worked on the posterior chain all the way up. We want the gait to work properly, and then we want to give it a break. So we're going to tape it really good with elasticon tape. This is the best tape. I have the patient actually wear tape for up to 2 or 3 weeks sometimes, at least 1 week minimum, so that we can get all of the inflammation down. That produces an environment where the tissues can heal without being strained. It's much better than a boot, because a boot creates too much malfunction. This allows the ankle to function good, but it does not cause a lot of hip disturbances and things like that. I will oftentimes have patients use a self-mobilization device, such as this one that I've devised, and you can buy the parts at Home Depot. After the person can tolerate this, we have them stand on this device and stretch the fascia of their feet. It's a little bit painful, but this is only used after the initial phase, depending on what they can tolerate. It's a great way to stretch the individual joints of the foot. So beyond mobilization, then there's exercises, and of course it will include things like calf raises, some band exercises, other things which I won't discuss in this video. Those we implement as the patient progresses so that they can start to strengthen some of the intrinsic foot muscles, but we don't jump off to those initially unless the patient is just a mild case. So I hope this helps you understand why the boot is not very effective, and it oftentimes makes it worse, how important it is to work that whole posterior chain. You got to treat it with taping and immobilizing that foot with a functional type tape, and then treat with self-mobilization and exercise. Sometimes dry needling helps. These things are all important in the process so that you can completely heal as fast as possible. So I hope you enjoyed this video. This is Scott Popp for Mobility Minute. Thanks for watching.